Hi, Eileen Veilleux The Fam here. Welcome to another installment in our mini mental health series. And in this installment, we are going to be going over the diagnosis and treatment for hair pulling disorder. But before we begin, let me just remind you to please watch the full video because in the video, there's going to be 3 keywords. When I get to the keyword, I will say keyword and then what that keyword is. At the end of the video, in the comment section, along with a genuine comment about the video, put in the 3 keywords mentioned in the video to be eligible for my pre-merch giveaway when I reach 2,000 subscribers. So let's get started. How do you diagnose hair pulling disorder? How is that diagnosed? Well, this is the way they diagnose hair pulling disorder. An evaluation to determine if you have hair pulling disorder may include examining how much hair loss you have, asking questions and discussing your hair loss with you, eliminating other possible causes of hair pulling or hair loss through testing determined by your doctor, identifying any physical or mental health problems that may be associated with hair pulling, such as OCD. Also using the diagnostic criteria in the Diagnostic and Statistical Manual of Mental Disorders, better known as DSM-5, published by the American Psychiatric Association. So then how do you treat this? Well, keyword. Research on treatment of hair pulling disorder is limited. However, some treatment options have helped many people reduce their hair pulling or stop entirely. One of these is therapy. Now, there are different types of therapy that may be helpful for hair pulling. One of them is keyword, habit reversal training. This behavior therapy is the primary treatment for hair pulling disorder. You learn how to recognize situations where you're likely to pull your hair and how to substitute other behaviors instead. For an example, you might clench your fist to help stop the urge to redirect your hand from your hair to your ear. Other therapies may be used along with habit reversal training, such as cognitive therapy. Cognitive therapy. This therapy can help you identify and examine distorted beliefs you may have in relation to hair pulling. Acceptance and commitment therapy. This therapy can help you to learn to accept your hair pulling urges without acting on them. Therapies that help with other mental health disorders often associated with hair pulling disorder, such as depression, anxiety, substance abuse, can be an important part of treatment. So, is there any medication for hair pulling disorder? Well, although no medications are approved by the Food and Drug Administration specifically for the treatment of hair pulling disorder, some medications may help control certain symptoms. For an example, your doctor may recommend antidepressants, such as anipranil. Other medications that research suggests may have some benefit include N-acetylcysteine. It's an amino acid that influences your neurotransmitters related to mood. And olanzapine, which is an atypical antipsychotic. Talk with your doctor about any and keyword all medication that he or she suggests. The possible benefits of medication should always be balanced against possible side effects. So if you have hair pulling disorder and you go into the doctor about it, find out the pros and cons on each of the medications before you take them. Learn about the side effects if there is any. Find out if there's any long-term damage side effects, if there is any. Always balance it out and talk to your doctor, work with your doctor to find out what's best for you. Now, the coping and support. How do you cope and support somebody with hair pulling disorder? Well, many people with hair pulling disorder report feeling alone in their experience of hair pulling. It may help to join a support group of people with hair pulling disorder, that you can meet others with similar experiences who can relate to your feelings. Ask your doctor or mental health professional for a recommendation or consider searching online for a hair pulling disorder support group. So that's what you need to know about hair pulling disorder. It is a mental disorder. Sometimes it is associated with OCD. And as you can see from this picture, you don't just always pull it from your hair. You can, pull your eyebrows or pluck them. Some men can do it from their chest. You can do it from your arm. The most common places, though, is the hair on your head and your eyebrows. You're right here. Those are the two most common. Now, don't get confused with, when you see somebody plucking your eyebrows. A lot of females do pluck their eyebrows, but that's because they just want them trimmer for makeup, or they have them waxed. That doesn't mean they have hair pulling disorder. As you can see, this is a male that is plucking his eyebrows. Now, a lot of times people with hair pulling disorder, they'll also, they could wear wigs or hair extensions to cover the bald spots. But also remember that there are some people that, do go bald. Like men can go bald at a young age, so can females. When a female goes bald, it's normally the hair thins out. There are other reasons why people go bald that you need to keep in mind. So you don't prejudge. That's the worst thing you could do. Don't ever prejudge somebody because you think they have it. That's when you need to learn to look with the heart. Ask questions. Because if somebody's going through chemotherapy, they lose a lot of hair through that. Certain iron deficiencies will make you lose hair. Okay? So you need to ask questions and don't prejudge anybody for anything. Always. This is why it is so important to always look from your heart and not with the eyes. Because what the eyes see isn't important. What's important is invisible to the eye, and only the heart can see it. So you always need to check. Get involved. If you have somebody that has hair pulling disorder, if you know a friend that has it, don't prejudge them. Don't shut them away. Get involved to help them out. Because a lot of times they're going to feel alone and everything else. Get involved, okay? So until I see you again, remember, I love you all. Have a great day. Bye.